Well, hi, everybody. My name is Bruce Weinstein. I've been a financial advisor now starting my 40th year. You're joined with my wife, Robin. Together, we have Planman Insurance and Weinstein Wealth Insurance Solutions. We do financial planning as well as all types of insurance work. You're here joining us today as we help people prepare for Medicare, turning 65 or beyond. And we're going to kind of give you the do's and the don'ts. Pardon me, I'm letting somebody else in. The do's and the don'ts about Medicare. We'd love to make this interactive with you, answer questions as we go. I'd appreciate everybody, if you haven't told us where you're joining us from, please tell us in the chat where you're joining us from. I know Anthony's up in New Mexico and Tess is in San Francisco. And I think Judy said she's in Fort Worth. So you can put it in the chat. I do like to interact. I'd love to see cameras on if you can, please. And let me see those pearly white teeth. And this way I'll know whether or not you need a dental plan when it's Medicare time or not. We are recording it. We will send you the recording. We have a slide deck that we're not going to use here just for timing purposes. So we're going to send you a follow-up as well as a link to our calendars in a follow-up email. So you'll have an opportunity at the end to also get our calendar, and feel free to schedule something to talk with us for a more individual conversation if required or needed. So not seeing any cameras going on, so love to see somebody. Maybe you want to put your camera on for me, my friend? So what do you want to know about Medicare? Well, Medicare begins when people turn the age of 65. Why do we do these workshops? Is as a financial planner, I started the industry in 1986. That's why I say I'm in my 40th year. A lot of people struggle with the decision making for retiring. And a big piece of that retirement decision stems around their health insurance costs, the continuation, having to pay those expenses, and then ultimately getting ready for Medicare. And unfortunately, as Robin and I have been working with clients now in the Medicare space, it's amazing how much lack of information for the volume of information that they give of what people really should or shouldn't be doing and the missteps that they have. And it costs them. It costs them financially. It costs them in availability of programs because sometimes they might inadvertently get locked out of something that would have been better for them, but they missed that window. So we're going to break all of that down with you and kind of take you through step by step. So first thing, Robin, why don't you put in the chat the link, ssa.gov. So when you're turning 65, your window with the government opens up 3 months before your birthday month. So if you's birthday is in May, February, his window is going to open. And he can go to ssa.gov and he's going to register for Medicare. Now, that registration comes in two pieces, Part A and Part B. And you're going to see a lot of letters and vowels and consonants going around as we go through this. So you may want to jot some of this down. Again, we'll send you the slide deck. It'll break it down with you. So Part A is for hospitalization. Part B is for your doctors. Now, You's a personal friend of ours. I'm glad he's joining us here. So I know you is probably going to not retire when he turns 65. He's going to keep working. And so if he's going to keep working, he's also probably going to stay on his company's health insurance plan. But when he turns 65, he needs to register for Part A. And that is free to most of us as long as we have our 40 quarters, 10 years of working, similar to Social Security. And then your Part A would be free to you. So you would register for A, but he would defer his B because there's a cost when you enroll in B that you pay the government. So if he's going to stay on his company plan, he doesn't want both expenses. He's going to defer. Unfortunately, again, here we go on the mistakes. We've seen people that have registered for B when they didn't need to. We had an 85-year-old professor down here at one of our local universities come to us And the gentleman was paying for his B for 20 years unnecessarily. That's crazy. Okay. So you want to defer. Your B expense starts at $185 this year, but that is also subject to income levels and what's called an IRMA surcharge. And Robin has the grid. She'll put that in the chat as well. So the IRMA surcharge will apply. It's a 2-year rolling look back. So use income when he was 63, and then his income at 64 is going to be assessed to whether or not he has a surcharge and will pay more than the $185. Does that make sense for everybody? There's a single person grid and there's a filing joint grid. So for a joint situation, it's around $240,000 of household income that now starts to get surcharged, and it goes all the way up to a $600 price tag or more. Okay. Now, on that same vein, if you have taken Social Security before the age of 65, maybe you're working, maybe you're not. Maybe you have a spouse that's still working. You took Social Security, but you're on your spouse's plan. Well, guess what? When you turn 65, Medicare automatically enrolls you because you are on Social Security. So if you doesn't want to be on Part B yet, he's got to go in there proactively and avoid that from happening. It could cause a problem. So you don't want to be inadvertently enrolled if you are taking Social Security before the age of 65. If you're still working, you're deferring your Social Security, you'll be billed quarterly for your Part B. Once you turn on Social Security, they will take your Part B out automatically. Again, this is an expense that goes to the government, not us, not an insurance company. You're paying Medicare themselves. Okay. I got a question in the chat. I'll be 65 next July. I have police retirement, daughter in college, full VA, and still full-time employee, not on Social Security. Okay. Is there a question, Anthony? That seems statement-esque. And Anthony has to chat with us. He's at work, so he can't come on microphone. Let me know if there's a question to that. I understand the statement, but I'm not sure what your question is. All right. So we have Part A, we have Part B, we have pre-Social Security, auto enroll we want to be careful of, and then we have the component that ties into spousal continuation and or your own continuation on a company plan. That said, one more item on that is what's referred to as credible coverage. When you turn 65, the health insurance plan you or your significant other is on has to be deemed credible coverage for you to be allowed to defer and most likely participate. Where we see that changing or being different is plans that are 20 employees or less do not allow their 65-year-olds to remain on their health insurance. Larger plans, 20 employees or more, we find will remain credible coverage and allow them to stay. Here's another oops situation. Literally came in Monday or Tuesday of this week. Somebody called us. They inadvertently went on Cobra. They stayed on Cobra for a good 8 months and now want to go on Social Security. They've already turned 65. The husband was 70 and the wife 72, I think, and the wife is 68, and now she's retiring. They've been on her plan. They went from her plan onto Cobra. Cobra is not credible coverage. They lost their window for their what's called IEP, initial enrollment period, is that 3 months before and 3 months after your 65th birthday. That's your IEP, initial enrollment period, unless you're deferring with credible coverage. So think of it as a get out of jail free card. Is you don't want to lose that card. That's your I can do whatever plan I want when I'm ready card. Why is that important? Because if you don't get on Medicare supplements at the beginning of your IEP or deferred IEP, any post-enrollment into a supplement, you come from Advantage onto a supplement or you missed your window, the supplements now have to be underwritten and you could be declined. Hi, you. How are you?
How you doing, Bruce?
Good,
Hey,
good.
Robin.
I think I saw Ann sticking her.
Yeah, she was helping me get the video because I was having trouble.
That's fine. That's okay.
I put it on my phone.
Good to see you. All right.
Same here.
So, what was I saying, Rob? I totally forgot.
I'm sorry, I interrupted.
No. It was my doing. So, we're talking about credible coverage.
Credible coverage.
Right? Okay. So, again, what you don't know and what you don't do can hurt you, which is why we're doing this to try and educate and make sure people don't make drastic decisions that are going to have a compounding effect. Okay. So the gentleman that now is on Cobra, coming off of Cobra, he's got to go back into SSA.gov. He's got to activate his Part B. That's going to take 2 to 4 weeks. Oh, by the way, there's a government shutdown right now, so who knows who's processing what. And now he's got to get on a Medicare plan during open enrollment, which started today and lasts till December 7th. So if he doesn't have his new card with his activated Part B and gets onto a plan, he's now lost his open enrollment. He has to wait a whole nother year. So these are problems we're trying to make sure people understand and help them avoid. All right. Any questions so far?
No,
When you, did you have a question, you?
no, Ann is talking to me, and
Okay.
I had to take my one earplug out to hear what she's saying. Sorry.
When you first register for A and B, that is what's referred to as original Medicare. Original Medicare is 80-20 coverage. You as a consumer are responsible for 20% of any medical bill, doctor bill, surgery, hospital. For the rest of your lives, you have a 20% exposure as we know it today. Who knows if it changes? So what do people do? Why are we here? Well, you've heard of things called Medigap, Medicare supplement. That's a synonymous term. That's the same type of program. And we're going to talk about Medicare supplements. And then the other side of the street is what's called Medicare Advantage. Medicare Advantage, in actuality, the government is selling you to a Medicare Advantage provider and pays them literally $10,000 a year to manage Tessa's care. That's why today, for the next 6-8 weeks, you're going to see all the Medicare Advantage commercials. You don't really see Medicare supplement commercials. You see Medicare Advantage commercials. The Jimmy Walker, the Joe Namath, the Joe Montana, and a gazillion other commercials are out there. Why? Because they're paid a lot of money to bring you into their network. And let me go down that path now. Medicare Advantage is a local network provided program. If you own a second home, if you spend lengthy amounts of time away from your home state, your Medicare Advantage won't work as strongly, if at all, outside of your local market. So you live in Middlesex County, right?
Yes.
So if you's in Middlesex County, and where are the boys living these days? They're still in the area, or are they out of the state?
One's in I guess we'll call it Sussex, New Jersey. The other's in Los Angeles.
Los Angeles. Okay. So now you and Ann want to go out and spend the summer with their son in California. His Medicare Advantage will not work leaving New Jersey and going to California. He would have to call and get onto a California in the LA market Medicare Advantage plan while he was out there if he was going to need or want to have services. Anything that's done out there could be either declined or considered out of network, and there'd be much stronger financial liability on them that Advantage won't take care of. Okay. So the flip side, especially for Robin and I, we have a lot of clients. We live in Florida. We're from New Jersey. That's how I know you, from New Jersey. We moved down here 11 years ago. We have tons of clients, as I'm sure some of you have as well, or know people. They have a vacation home. They snowbird. You know, Californians go to Arizona or they go to Mexico. You know, people go to different markets once they're retired for vacation or to see family. If you're on a Medicare supplement plan, it's national. There's no network. There's no provider you need to worry about. As long as the doctor, the hospital, whomever you're seeing participates in original Medicare, and it's a Medicare deemed service, approved service, i.e. cosmetic surgery is not covered, just like your normal under 65 health insurance. So anything that's deemed approved by Medicare is going to be covered under your supplement. Okay. So again, some of the differences between the two. Medicare supplements are a cost. There's a premium involved. The premium is determined by the insurance company, and it certainly is influenced based upon geographics. As an example, if I were to plug in something for you in his area, a Plan G, I'll get into what these are, but a Plan G in used market might be around $250. Down here where we live, it's also around $250. Long Island, New York City, probably over $300. But we have clients in Texas, and I think Judy said she's in Fort Worth. We have clients there. It's only $125, $130. It's literally half the cost. So a Plan G, that's a supplement, not Medicare Advantage. It's a supplement. So you basically, let me go back. You're going to go on original Medicare, 80/20, and then you're going to use a supplement to fill in the 20%. Plan G, as in George, is the strongest of the supplements. The prices will vary, as I just shared. The plan is identical across the board. It doesn't matter whether it's Humana, Cigna, United Healthcare, who am I missing? United Healthcare, Bankers, Fidelity, Aflac. There's dozens of players in the supplement market. They all determine their own price. The coverage is identical. We have, again, people have come to us making the mistake. Oh, I had United Healthcare at work and all my doctors are there, so I just took the United Healthcare supplement, which was the 5th most expensive one. They could have had one of the other 4 and saved money. So one of the things that Rob and I do is we will show you what's available in your market by zip code. And we simply go usually by price. Okay, Tess, did you have a question? I saw your face lighten up. No? So again, we spoke to somebody not that long ago, and she took United Healthcare, and I said, why? And that was her answer. And I said, well, do you know there's other options in your market? She self-enrolled. She had no idea. She just called United Healthcare. They gave her a plan, and she's paying whatever their rate was. Okay? So we have supplement. When you go down the supplement path, I like to use the terminology, everything is a la carte. You pay for your Part B separately. You pay for your Plan G. You then have to enroll in a prescription drug plan, your Part D, as in David, like drug. And then if you need dental and vision and hearing, those are all separate enrollment items. If you go Medicare Advantage, a lot of that is bundled. You'll always pay for your Part B to the government, but then when you go on Medicare Advantage, most of those are premium free. You're not really paying for the advantage. It comes with a prescription plan. it comes with a so-so dental vision. Not the greatest, but it's something a lot of clients will still opt into a stronger and pay extra for a dental vision plan, depending on what's going on and what their needs are. Okay. So, one is very kind of put together for you, but it does have restrictions and limitations. The other is a la carte, has a lot more fluidity, flexibility, no networks, travel anywhere you want to go. So again, as you go through this exercise on your own, down the road with us, these are things we're going to be helping you assess. What's your situation? So when we have a client that, has a couple of homes and ping pongs around, supplement's beautiful. They don't have to do a thing. Okay, it works for them.
Yeah, what about my case where we, but I
Oh,
also,
Anthony, I can barely hear you. I know you're talking. Are you talking to us?
yeah, how about now?
Go ahead.
Yeah,
I'm
better.
sorry. Go ahead.
Yeah,
Can you say it again?
that any better?
I'm hearing you, but I'm not making out
Well,
what you're.
it's kind of muffled. I don't hear anything.
Okay. I'll move. Anthony, we can catch up separately, maybe grab a quick call or something or stay afterwards. We're having trouble hearing you. All right. So, Robin, let's go down the list. We mentioned Irma. We talked a little bit about prescription drug. I want to talk more about that. There's been a seismic shift in the prescription drug side of the market. Last year, President Biden enacted the Inflation Reduction Act. That's a good thing. What they did was they reduced the prescription exposure for Medicare recipients to a limit of $2,000 a year. Up until that point, you've heard the term, may have heard the term, or have friends or family. There's a donut hole. The donut hole runs around $6,000, maybe $8,000. So you'll have coverage, you'll hit your donut hole, you pay for everything, you finish paying the donut hole, you come back, and they'll start to cover you again. So instead of having $6,000 exposure, now it's two. So that's great for all those people on expensive medications. Okay. That said, I lost my train of thought.
Let me just share that
Yeah,
$2,000
go ahead.
exposure, whatever company you're with, whatever medication you're on, if it is expensive, that the $2,000 doesn't count if that medication is not on that company's formulary. So if you take an expensive medication that's not on the company's formulary, that 2,000 doesn't come into play. Long as it's on their formulary, that's a different story. But if it's not covered by a certain company that you're with, that $2,000 doesn't
It's irrelevant.
isn't a factor, right?
So where I was leading with the prescriptions, because of the shrinkage of the donut hole and the limit of the 2,000, the knee-jerk reaction is agents like us got notification from the prescription drug plans, the providers, which are all the same names, by the way. It's Aetna, United Healthcare, it's Cigna. Like they just have different buckets. So you might say Aetna. Well, there's Aetna that's on Obamacare. There's Aetna that has group plans. There's Aetna that has dental plans. There's Aetna that has Medicare supplements. There's Aetna that has Medicare Advantage. Like Aetna has a lot of different silos, right? Different buckets. So what now happened is the majority, a large percentage of the prescription plans terminated our contracts. They don't want to pay us. Now, it wasn't overly lucrative, but because that 6,000 goes to 2,000, somebody's got to eat the $4,000. And so the insurance companies, whoever was relying on that relief, now that relief is gone. If you was gonna pick up his expenses for another $4,000 before the insurance pays, now they're putting the $4,000 back on the insurance company's shoulders. Okay. So now they're cutting costs. So they terminate the contracts. They no longer will pay us, which means we can no longer recommend, we can no longer enroll. So I know in U's family situation, they're getting ready with open enrollment to review and make changes. I can't help them. I can't help them with their prescription plans anymore. It's you're now being left to your own devices. You have to work directly with Medicare or the carriers and see their plan. But you have to literally call every carrier because there's no synergy. Our software shows everybody in the plans. Your medications, CVS, Walgreens, Costco, Walmart, all the providers that you fill your prescriptions, what your prescriptions are, how much the plans are, what your costs are. We have software that assesses all of that that is now basically useless because we can't recommend it. We can't do it anymore. You have to do it on your own. So this is going to be a problem. May not be a problem today if you're younger and newer on it, but I think about an elderly person, a sickly person, somebody's on 15 medications. They have to renew this every year. Now they don't have help. Okay. Or you just have, we're not abandoning our clients. We're still helping them, but it's nationwide is going to be a challenge. Okay. So keep that in mind as you're doing these things. All right. So let's see. So I'm looking at my cheat sheet here. So we got IRMA, we got prescription drug. We talked about Medicare supplements. So I mentioned Part G. There's also an N as in Nancy. It's a little tier below. And then they have some high deductible plans as well. So there are different choices in the supplements besides the G. The G is the strongest. In 1999, in 2025, this year, the plan G has an annual deductible of $257. Go ahead, Rob.
I, oh, I just wanted to share, as far as a drug plan goes, if you go with a Medicare supplement, we have a lot of people turning 65 that say, 65 is the new 45, right? I don't take any medications. I'm not on anything. I don't need a drug plan. When you have a Medicare supplement at the time of your initial enrollment turning 65, it's not mandatory, it's not law, but you would choose a drug plan at the same time, even if you're not on anything. And there's some very inexpensive ones, because if you decide not to choose a drug plan down the road, when you do choose one, whether it's a year from now, 5 years from now, I had somebody 20 years hadn't chosen a drug plan, you will be penalized 1% every month of the national average that you've gone without prescription drug coverage. So even if you're not on anything, you want to choose a drug plan, the most inexpensive one, just to get your foot in the door, so that when you do take medications and you have to pay those costs, you don't have a penalty on top of your plan. And that's a non-negotiable. That will follow you forever. There's really nothing you can do about that. So you always want to make sure a supplement and a drug plan run parallel and are chosen at the same time. Okay?
Thank you.
You're welcome.
So I was talking about, we're bouncing around. I apologize. So in the subspace, you have G, N. The G has a $257 deductible on a calendar year. So you have a premium. So in Judy's case, let's say it's $125 for the premium. Outside of her premium, she has the small deductible, and then everything after the deductible, as long as it's a Medicare approved service, is 100% covered. There's literally no more financial exposure once you hit that small deductible. And that's why our clients love it so much. They may not like the premium, but they know that that's their only financial exposure. So when you're building your budget, you have a fixed cost every year for the insurance, for the supplement, but then you're not going to get hit for a $5,000 bill, a $10,000 bill when you need a knee replacement, shoulder repair, pickleball injuries, whatever's going on, or God forbid, worse things. That's your exposure. Okay. Robin and I like to say jokingly, it's Medicare disadvantage, not Medicare advantage. And the reason being is some of the things we've already talked about. is the exposure on Medicare Advantage has an annual maximum out of pocket. You also have copays. So again, depending on the strength of your plan, Medicare Advantage is premium free in most cases, but it has exposure. So once you start using services, if it's ongoing, every year your plan has an annual maximum out of pocket. Most of them run $6,000 to $8,000 and go up. So every year it's going to go up. So once you start incurring bills on a regular basis, you're always going to be paying that maximum out of pocket. So most people that we've encountered want to leave Medicare Advantage when that starts happening and move on to a supplement. And they're willing to pay the premium because the premium normally is less expensive than that annual exposure is. The problem is once you're outside of your IEP, your initial enrollment period, should you want to change over to a supplement or even change between supplements, you have to go through underwriting. And there are medical questions that are knockout questions, and you could be declined. As an example, cancer, heart attack, stroke, lupus, MS, diabetes. You're not going to be able to come back. That's why it's so important to maintain the integrity of your IEP. So we had a call last night with a client. He's had a stroke. He's in a wheelchair. We're making sure they don't lose their IEP when they're ready because he'll never qualify for a supplement if he misses that window. Does that make sense for everybody? Okay. Any questions from anybody?
Not right now.
Okay. All right. The last couple of pieces I have are more on operational procedures, things you need to know, consumer protection, stuff like that. All right. So again, I'll just kind of summarize. So you have A and B. You're going to look to turn that on and or defer your B. You then have to decide between supplement side of the street, which is a la carte, or a Medicare Advantage. All right. When you get involved with an agent, whether it's us or anybody else, there are some basic rules. One, we cannot contact you. You have to contact the agent, which is why you see all those commercials on TV trying to get you to call them. They're not allowed to call you. So if anybody ever calls you and says, hi, da 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 da, Medicare such and such, hang up. It's illegal. They're not supposed to do it. They're breaking the rules. If you has his buddy Rory, who's interested in talking to me and says, hey, give my friend Rory a call. He needs your help too. I have to tell you, I cannot. You need to ask Rory to call me and begin the process. It's kind of like an attorney. You know, attorneys are not allowed to solicit. Attorneys are not allowed to call on people. You have to call the attorney to initiate, similar in Medicare. Okay? Once you've broken bread, you began that communication, you get started with them, you have, we ask for a copy of your card. So you're going to go to ssa.gov, you're going to apply, it's going to take 30 days, you're going to get your card. Your card's going to have a Medicare ID number that's unique to you, kind of like your Social Security number. You're now going to have a Medicare ID number, and then it's going to have on your card your effective dates, effective date A and B. We have to work off of those dates. Those are the first dates you can get services. So if you has applied for A and deferred B, there's going to be nothing on his card for B. When he's ready to retire, ready to leave his company plan, ready to move to Medicare, he's going to have to go back onto the platform and add or now apply for his B, which is going to get him a new card. And his date for B is going to be different than his date for A. We're going to take that card and now we're going to start to build out our client's profile. We send you a fact sheet, name, address, all that type of stuff. Okay. From there, we're now required, again, these are all CMS, these are all government rules. You have to provide us a signed scope of appointment. So we provide you electronic signature on our end. Some people have, paper and pen, but you sign a scope of appointment, and there's 4 boxes, and you mark off the boxes you want to discuss. Medicare supplement, Medicare Advantage, prescription drug, dental vision. Those are the 4 choices. If you fill out one box and leave the other 3 open, we can only talk about the item you checked off. This is consumer protection. So you inadvertently sent me a box that only had dental vision marked off. I'll be like, you got to redo it. Okay. You need to talk to us about more than just dental vision, right? So the purpose behind this is people door knock, they prey on the senior market, they find some, sweet old couple at home, and they let them in. Hey, we're here to review and do your Medicare. And the next thing you know, they're buying an annuity and aluminum siding. They got sold everything else but actually Medicare. So again, the practice is illegal. The requirement is to get a scope of appointment, and the only items you can discuss are what are checked off. You and I obviously have a personal relationship. While we're doing his enrollment, he wants to ask me about his homeowners, his car insurance, his IRA. He wants to talk about his grandkids' college account. I cannot discuss anything else, even though he's a friend, even though he's a client. I can only discuss during his enrollment the items that he's checked off. So again, if you never talk to us again, you work on your own with somebody else, know the rules. Make sure you're dealing with somebody with that integrity, that they're not, oh, by the way, do you need an annuity? Let's talk about final expense life insurance, so your family can bury you someday. And has to be another conversation. Additionally, we're required to record our conversations and keep them on file. So if somebody's asking us about these other topics, we have to stop recording and start over. We cannot discuss those other items. So if we start getting into it and we've now violated, we have to end the call, start a new call. Okay, let's talk about the grandkids. Okay? Make sense? All right. Scope of appointment, not our choice. We get that in. Guess what? Once you send the scope of appointment back, there's now a 48-hour cooling off. We have to wait 48 hours before you can book an appointment with us. I don't know why. That's the rule. Unless it's like the last day of the month for your enrollment. If it's October 15th, 4 days. 4 days. 4 days before the end of the month, you're allowed. Go ahead, you can jump in.
Yeah, the last 4 days they waive it because there's
Last
just,
4
there's just no time. If somebody
Right.
needs to be in by the 1st.
Which is ridiculous, because if it's okay at the end of the month, why isn't it okay all the month? But those are the rules. Okay.
Yep.
We send you the scope of appointment. We wait 48 hours. We now send you our calendar link. You book a call. We have to record the call. We do Zoom, or we use our office line that records. We have to keep that on file. I'm almost done, right? We're almost done.
You're doing good. You're doing good. In time.
Dental, vision, and hearing are not CMS programs. They're private. There's no timeline. You're not obligated to buy anything. And you can buy it anytime after you've turned 65. So if you decide you don't want anything now, you're going to wait a few years, you got good teeth, you're from the fluoride generation that I grew up in, and your teeth are pretty decent. You feel like, I don't really need it. And then somewhere down the road, you decide you want it, you buy it anytime. Dental vision plans are available as fast as the next day. So if you calls me and says, hey, I cracked a tooth, I don't have insurance, can you get me something? Yeah, I can have you covered on October 16th. And then he can call the dentist and go get his tooth fixed. Okay? So outside, if you're on the supplement and you're a la carte, you have the option or not to take dental, vision, hearing. Okay? If you're on Medicare Advantage, a lot of them offer that as part of the package. Okay? What you need to know and understand is the extensiveness of the coverage. Okay, so as an example, implants, bridges, root canals, the crowns, the expensive stuff, some of that stuff they may not cover as strong as a private plan might. Okay. Medicare in general, whether you're on a supplement or advantage, doesn't work outside the United States. It's not long-term care for extended nursing home usage. So as our clients age, maybe have to go to the hospital, they need rehab, they're sent home. That's a whole separate conversation that you have with us as long-term care insurance providers, your financial planner. Maybe you're self-insured, have money put aside, you have an annuity that covers it. There's life insurance and long-term care insurance programs, but Medicare will assist in the first 20 days of a nursing home situation if you've gone through a hospital first for a minimum of 3 days and 3 nights. So the not to be negative karma, but somebody has a stroke. They're in the hospital for 3 days and 3 nights. They're not ready to go home. They need to go to rehab. Your Medicare plan, Medicare supplement will cover 100% of the first 20 days. After that, the benefits diminish, and at 100 days, it's gone. So it's not a long-term solution. That's why it's called long-term care, is you need private coverage for that. A lot of clients travel internationally. Your Medicare supplement has a maximum benefit of $50,000, but it's very restricted in the coverage. We always recommend clients we offer international travel, whether you're cruising, you're going to Europe, Asia, wherever you're going, you can pick up reasonably inexpensive health insurance outside the United States. But again,
50,000 lifetime.
lifetime. I thought, yeah, 50,000 lifetime.
Lifetime. Yep.
That's like one medevac and you're done. So, okay. So Medicare works in the United States, doesn't really work outside the United States. If you're going to leave this country and live abroad and retire elsewhere, it's useless. Your Medicare's not going to do you any good. Okay. Same with most US based health plans, right? You need international coverage. We talked about long-term care, scope of appointment. What else? I think that's it, Rob.
Yep.
Right?
I do too. Yep.
You have 30 days. Sorry, you have 90 days after your birthday. So you have 90 days before your birthday, 90 days after your birthday. That 7 months is your IEP. You need to embrace that. You need to understand that timeline. If you have a qualified plan, credible coverage, where you works as credible coverage, he can stay there, work there, use their insurance till he's 90 if he wants. The question is, I know you don't want to. I said if you want.
Yes.
The only way to be absolutely sure if your company is offering credible coverage, speak to HR. They can tell you in one sentence if what they're offering you now is credible and if it will be that bridge that you need. Okay.
Information is power. I can't say it often enough, over and over enough with all of our clients, anybody we talk to. The more you know, the more we know, the better decisions you can make. Okay? That's why I'm the plan man. It's all about planning. I'm proactive. I ask the questions. I make sure you know the questions to ask, who to ask them, and make sure you're staying on the right path and getting the best coverages, options, whatever that is available to you. Okay? We're going to put our calendar link in the chat. It will be sent to you in email tomorrow. Anybody wants to have a 15, 30-minute call just to talk a little bit more. I know Anthony dropped off. He had VA questions. That's a hairier topic. I told him we could talk privately about that in his situation. Everybody has uniqueness. Everybody has their situation. But hopefully this was helpful to everybody, informative. Again, I want to hear questions if you have any. And if not, we hope that you take advantage of a consult and talk to us when the time's right and tell other people to come join our webinars in the future. Tess or
Thank you, Bruce.
Ira, anything?
Thank you,
Thanks,
Robin.
you. Good to see you, buddy. You have any questions, you?
Thank
Anything?
you. No,
Okay.
I'm pretty good. I'm pretty safe.